Hi, this is Dr. Sriya from SVS Medical College. My title is Outcome of Glue-Free and Sutureless Limbal Conjunctival Autograft for Primary Pterygium Excision Surgery. Introduction. Pterygium is defined as a degenerative ocular surface disorder with wing-shaped fibrovascular growth of the subconjunctival tissue onto the cornea. The epithelium may be normal, thick or thin, but it may occasionally show dysplasia. A small pterygium can only cause slight irritation, cosmetic blemish, and slight heaviness or redness in the eye, but if it gets advanced, it may cause impairment of vision. A number of surgical techniques have been described for management of pterygium, which include bare sclera resection followed by mitomycin C application, pterygium excision plus conjunctival autograft, or amniotic membrane placement. Materials and methods. In this study, autologous limbal conjunctival autografting was done without sutures and glue, which is represented by group 1, and the results were compared with those obtained with sutured autograft, and it is named as group 2. Inclusion criteria: patients of all ages and sexes presenting with primary nasal pterygium. Exclusion criteria is recurrent pterygium, temporal pterygium was not included, glaucoma, retinal pathology requiring any surgical intervention, history of previous ocular surgery or trauma. Surgical techniques: peribulbar anesthesia with 2% lignocaine and 0.5% bupivacaine was given preoperatively. The body of the pterygium was dissected 4 mm away from the limbus down to the bare sclera. Pterygium was removed from the cornea by avulsion. Only thickened portion of conjunctiva and the immediate adjacent subadjacent Tenon's capsule showing tortuous vasculature were excised. Large hemorrhages were tamponade with direct compression, cauteries avoided. Oversized graft by 1 mm was used after measuring with Castroviejo's caliper. The graft was taken from 12 o'clock position. Results: a total of 50 eyes of 50 patients were studied. Here there is table 1 or figure 2. Demographic profile of the study population, where group 1 represents glue-free and sutureless pterygium, while group 2 represents sutured pterygiums. And both of them are in the age between 25 to 75. Figure 3 represents first post-operative day and post-op 3 months of sutureless and glue-free flap, while figure 4 represents first post-op day and post-op after 3 months of sutured flap. Table 5 is a comparison between two groups that represents an average surgical time, while group 1 and group 2. Group 2 takes longer duration, post-operative symptoms are more, that last for about 4 weeks associated with graft edema, and group 1 is less surgical time, post-operative symptoms are seen in about 20% of the patients that last for about 2 weeks, and graft edema is seen in only 8% of the patients. While performing the surgery, it should be kept that not only excision of the surgery is important, but also reoccurrence should not happen. So whenever we put on a graft, that will actually help in restructuring the limbus, so there is no recurrence usually. Conclusion: sutureless and glue-free limbal conjunctival autograft is a new novel technique for treatment of primary pterygium. Not only the surgical time required is less, but also the complications encountered are fewer than suturing technique. Moreover, the feasibility, absence of cost factor, suturing process, and potential adverse reactions encountered with the use of foreign material to make it superior to suturing. More research with longer follow-up is required to add the knowledge about both of the techniques. These are the references. Thank you. I hope everybody had a good nap while I finished my presentation.